seeing this sudden surge in cases, 2,468 in one day. What does this say about how people are behaving despite all the government's warnings and the fact that the government has done this to make the common man's life easier? Why is it that we are not following the SOPs that the government has advised?
Well, there is a lot of blame game. Unfortunately, people are at the heart of receiving end, and no one is talking their perspective, the public perspective. There is a parallel reality, which is not being reported, which is not being analyzed in Pakistan. Every day we see the scoreboard like a cricket match. The number of the people who tested positive, they are going up. The people who have died, they are going up. But nobody is checking what are the realities. What are the standard procedures which are being followed to enlist these people who are dying of, in fact, natural death, but they are being included in the COVID-19. So I think there are a lot of controversies. Unfortunately, the mainstream media is not reporting. I have spoken with people across the country, particularly in Sindh. They are suggesting that those people who are dying of natural death, they are being included as COVID-19 patient. And that is something which is entirely changing the landscape of policymakers on the basis of which they are making their policies. And then similarly, those people who are testing positive, again, there are complaints that despite the fact that they tested negative subsequently, they are not being discharged from the quarantine center. And very importantly, that most of these private labs, they are testing negative to those who tested positive in official labs. So I think Prime Minister of Pakistan needs to conduct an investigation to know what is happening around. PTI Sindh is blaming the Sindh government that much of the statistics that they have come up with, that is bogus. This is a very serious allegation. I wonder why there is no independent investigation. And then also there's...
Javed Sahab, let me ask you this also. There are different theories. What you seem to believe is that the number of cases is being exaggerated. What many other people think is that a lot of people who have died from natural causes, who are being taken to the hospitals, don't get tested for whether it was COVID-19 or not. So there might actually, some people think that there might actually be a lot more cases of deaths than we previously thought. Plus the very limited number of testing that Pakistan has done. Europe, UK are doing 200,000 tests per day. I think Pakistan has only done that many tests for the entire duration of this pandemic. So many people think that maybe this the number of cases is underreported and not overreported. So there's a bit of confusion over there.
I think since I am more close to the facts, so I'm reporting facts. It's not an any analysis. Look at what is happening in Sindh. People who have died of natural death, somebody who had a low blood pressure after breaking their fast, they went to the hospital and they did not return from there. They were declared COVID-19. And similarly, people are genuinely complaining that they had known symptoms, known diseases, and every year they face similar problems. Once they enter in the hospital, they did not return from there. Now, on what
so
basis
what would be the purpose of stating that these people died of COVID-19 when they didn't? What would be the purpose of misrepresenting these numbers?
Well, I think all we are hearing from the hospitals and the people from within the government, there appears to be a keenness, eagerness to portray these as inflated figures. I don't know for what reasons. Now, doctors are themselves admitting that 25% of these tests could be either way wrong. So, and then I think, isn't it a bit coincident or something else that most of the people who are testing positive, they have turned out to be the patient of diabetics, asthma. And the first patient of AJK, Khwaja Sanaullah, he tested positive. He was a patient of asthma. His entire family, 11 to 12 members, they were tested. They tested negative. This shows that those people who have a casual contact with a patient of COVID-19, he may not test positive. So our policy making is based on medical assumptions. There are no hard realities on the basis of which we are making up our policy. So I think we need to review our policy, and more importantly, we need to reinvestigate all those cases. I am receiving many complaints. In Dipalpur, one person died and the authorities buried him without proper Islamic rituals, and the next day his test came, which was a negative. And there are so many cases if we find around. That is why people are not observing these SOPs, because people are not taking it seriously.
Right, because there seems to be a degree of mistrust in what authorities say. This is a very common thing in Pakistan, that mistrusting whatever information one gets officially. However, also I'd like to add over here, there are a lot of people who've had COVID-19 and recovered. It's not necessarily a death sentence, but as you were saying, diabetics and asthmatics and people with lowered immunity, they're at a higher risk. So one of the main reasons the extra precautions are needed is to protect those elderly, vulnerable and sick people.
Well, I think there is another aspect which we are ignoring, and which is that there are medical doctors in the West, they are pointing out that anyone who had certain kind of vaccination in the past, and this could also mean if somebody is under certain kind of medications, he is more prone to be tested positive. That doesn't mean that he has caught a certain virus. We should not ignore those medical opinions where people are saying that this particular virus has got mutated in Pakistan. It is not as aggressive as we have seen in the West, as we have seen in Iran, as we have seen in the US and China. So I think we need to have a bigger picture of the situation. The parallel reality that exists on the streets is a very different on the scoreboard that newspapers and the media is portraying every next day. They are basically selling fears, and we are listening to them very seriously as if it is a sort of a Quranic fact. It is not the fact. When the doctor themselves are saying that these medical tests could go wrong, this can be possibly misleading, they have not been able to develop a kind of a medical mechanism where these tests could be authentic. So why we are so terrified, so panic about this scoreboard going up? I'm sure that most of the people who have tested positive, most of them are asymptomatic, and the kind of the immune system that people have, they would not be knowing that they had this particular virus, and then it has perished. So we need to develop a broader medical policy, health policy, which should we follow. We should not pursue blindly the kind of the Western standards that we are trying to impose on our people. The reason being is that look how the African countries are dealing with this. There are alternative means through which we can treat our people, we can cure our people. But again, we are focusing heavily that we need to wait for next 2 years and keep the entire country locked down until there is a vaccination. Why can't be this virus cured through other medical means? There are traditional medical means, there are herbal medical means. Again, we are not focusing on this because the pharmaceutical companies have their vested interest, and unfortunately there are so many people in Pakistan who are promoting those interests, and we are creating a unnecessary hype. This virus is there, it is a reality. Those who have a sustained exposures like doctors, they are very much vulnerable, and those who have a casual contacts, they are not vulnerable. Let's see, our Prime Minister met with the facility, he had a casual contact, our Prime Minister tested negative. So that is itself is a big proof that we should not spread this panic, we should not spread this fear unnecessarily. It is destroying our economy. Right from the first day, day one, Prime Minister is saying something else, but it seems that the Prime Minister has been surrounded by those who have a different agenda, and that agenda seems to be the agenda of those pharmaceutical companies.
Right. Sir, also now, I mean, if we look at what you're saying, and also what we can also see that coronavirus is not necessarily a death sentence. There are many people who I know who've had it and who've recovered, many of them in the United States, in UK, even in Pakistan. So most of the people are recovering. There's a very small death rate, maybe 1 or 2% at the moment, and which also seems to be even lower in Pakistan. So that is one positive thing. And Asad Umar, he said that the advisor for planning minister, he said that, you know, we have all these deaths every month from car crashes, so that doesn't mean that we should be stopping cars from being on the roads because they're needed for the economy. And also, when you look at influenza, that kills a large number of people every year as well. This is the issue with the COVID-19 is the unknowns. The fear factor is very much inherent in this illness because we do not know how this particular virus functions. It's the first time everybody is dealing with it. So isn't it better to err on the side of caution and take the precautions and wear the masks and use the sanitizers and observe the social distancing?
I think that is another reality. We need to have a moderate precautions in a manner that our economy is there. The cycle of the economy goes on, and the cycle of the economy is not brought to the grinding halt. It's something which many people, unfortunately, in Pakistan, they are projecting this as a panic, as a fear. I think that will bring our economy to the grinding halt. What is extremely important, I insist that Prime Minister must conduct investigation into those positive cases. Those who are testing negative in the quarantine center, why they are not being discharged, why they are not being given their negative or positive reports. There has to be transparency, why that transparency is not there. And also, very importantly, those who are dying and being listed as COVID-19 deaths, they are not all of them are COVID-19 deaths. They died of natural death. I have come across some of these cases, and I have fairly good idea that there are manipulations in our statistics which are being manipulated to do what? Whose vested interest is there? Is it out of pure some sort of ignorance, or somebody has an agenda? We don't know. But I think this is extraordinary, very serious situation. Why can't we conduct an investigation about all these deaths which has been linked to the COVID-19? It is, in fact, I would say, just compare the data. How many people died in these months last year? Let's have a comparison. I think when you will make comparison, when you will go into the investigation, you will come to know that there is a different reality. People know that this is a different reality. That is why whosoever is, many people who have tested positive, they locked down their homes, they ran away because they are being stigmatized. So you see, and also there is another factor. People are not scared of going to the hospitals. They know if they go to the hospital, their dear ones may not return from there. And the administration would conduct their burial. That kind of perception exists. So when that kind of perception exists, you tell me why people would follow government's SOPs. It's quite clear.
Right. Thank you so much, JAVED Rana, for joining us on our program. That's a senior journalist who's seeing the situation right there on the ground.